Hello, I'm Dr. Sue Ng. I'm a gastroenterologist at the Institute of Digestive Disease, Department of Medicine and Therapeutics at the Chinese University of Hong Kong. The editors of Gastroenterology have asked me to discuss a paper that is due to be published in the March issue of Gastroenterology this year. So this paper is entitled Increased Risk of Advanced Neoplasm Among Asymptomatic Siblings of Patients with Colorectal Cancer. Familial colorectal cancer accounts for up to 30% of all cases of colorectal cancer, and it can be due to either shared genetic factors or acquired factors, but the contribution of each of these factors is less clear. So there are several reasons as to why we chose to conduct the study. First, the incidence of colorectal cancer is increasing in our locality, and it is now the second commonest cause of cancer and cancer deaths here. Because there are no specific genetic markers available for common familial colorectal cancer, screening and surveillance are mostly based on family history. And most studies that have actually reported increasing risk of colorectal cancer amongst family history with colorectal cancer are again mostly based on a positive reported family history. So in other words, there are lack of prospective data. So we were interested in the question of what would expect to find on colonoscopy of close relatives if the index case is found to have colorectal cancer. So in this study, we focused mostly on siblings. We hypothesized that asymptomatic siblings of subjects with colorectal cancer have an increased risk of advanced neoplasm and cancer. So the next step is to determine the optimal study design. The best or strongest possible study design would be a cohort study following two groups of patients over time. The first group would be subjects with a family history of colorectal cancer, and the second group would be first-degree relatives of subjects without colorectal cancer. The study will measure the prevalence of colorectal cancer or advanced neoplasm and adjust for demographic features. Because this type of studies will require many participants as well as several years to be completed, it is unlikely to be done. Now, an alternative acceptable study design, which is what we did, would be a prospective cross-sectional study, comparing the prevalence of advanced neoplasm and colorectal cancer amongst subjects with a family history of colorectal cancer with those who have no such family history. The challenge in this study would be to find the right control group. So we are able to take advantage of an earlier cohort who had negative colonoscopies during colonoscopic screening. And asymptomatic siblings of these individuals in fact represent an ideal control group for our study. So in this study, what we did was to prospectively recruit cases, and these are siblings of subjects with histologically proven colorectal cancer from our cancer registry. And we then offered colonoscopy to siblings of adenoma or cancer-free individuals. These siblings were then age and sex matched with the cases. We then performed colonoscopy to validate their findings in both groups during the same time period. The primary outcome of our study was the prevalence of advanced neoplasm and cancers. So what we found in this study was that siblings of subjects with colorectal cancer has a significantly higher risk of advanced neoplasm, including cancer, and this risk was increased by greater than threefold. Even when we restrict our analysis to just one sibling per family in order to minimize the effect of familial clustering, this risk was not diminished. In addition, the risk of total adenomas were also greater than twofold in those with a family history of colorectal cancer. When we then look at the index characteristics, we found that if the index case had distal colonic cancer, or if they were female, then the risk of advanced neoplasm was much higher in the siblings. So based on the results of our current findings, we conclude that screening for siblings with colorectal cancer is strongly recommended. First of all, we'd like to promote awareness amongst close relatives of those with colorectal cancer. And the higher prevalence of advanced neoplasm detected on colonoscopy in these siblings further contributes to the literature and anchors current guidelines recommendations for screening.